Mrs. Johnson.
Hi there.
Hi, how do you do? Nick Boyle, please
Hi.
come and take a seat. How are you?
Fine, thank you.
Good. So very nice to meet you.
And you?
I think you've come today to talk about reflux, is that right?
Yes, that's right, yeah.
Okay, well, what I'd like to do first is just ask you a few questions just to work out, what exactly is going on. So let's start at the beginning. Can I ask you how old you are?
I'm 42.
You're 42. And tell me, what are your main problems?
Well, I've had reflux for about 8 years now, so I get a pain in my chest after eating. Not all the time, but a lot of the time. When it first started, if I bent forward, I really felt like the food was coming back up, and that's I still have that now.
Has that got worse over the years?
Yes, it has. I've just learned to deal with it, I suppose. I try not to bend down after eating so much.
Does it interfere with your life?
Having the reflux definitely does, yeah. Because I've had to change what I eat. I've tried to cut down on how much I drink, how much alcohol I drink. I tend to not go out so much now in the evening because I know it's bad for me if I eat late at night. And in recent years it's affected my sleep as well, because a lot of the time I wake up in the morning and I feel like I've got a sore throat.
Sorry to interrupt, does it ever actually wake you at night?
It does sometimes. I feel like I've got acid in my throat. And sometimes I get up and take some Gaviscon, and so obviously it's a bit disruptive.
Okay, so you're saying to me that you get food and acid regurgitating up into your mouth, and did you say you also get burning in your chest?
I do, and although it did get better when I started taking omeprazole.
And when was that?
Well, I first started taking it 8 years ago.
Yeah, okay.
But then, and it did work. I still got the regurgitation, but the chest pain definitely got better. But about a year ago, the chest pain came back again, and so my GP upped the dose.
So you're taking, do you know what dose? Is it 40 milligrams a day?
Yes, I was taking 1 tablet a day, and now it's 2.
Okay. So let me just ask you about some other symptoms. Do you have any problems with your throat?
It's sore in the morning. It sometimes gets better throughout the day, but it does sometimes hurt in the morning. And I sometimes notice that I sound more hoarse than normal.
And does that affect your quality of life, what you do?
It does, yes, because if I'm doing something at work where I need to speak a lot, I tend to not go out as much, or I think I've got to just not have any alcohol at all, because I know that'll make things worse.
Okay. Do you ever have any difficulty swallowing or notice a lump in your throat?
Not swallowing, but I do sometimes, more when I wake up in the morning, it feels like there's a lump in my throat sometimes, yeah.
Okay. And what about a cough?
Nothing terrible. Now and again I've woken at night time coughing a bit, but I wouldn't say it's been a huge problem.
Okay. And asthma?
No.
And you say you've had this for 8 years and you were started on omeprazole when it all started.
Yeah.
Have you had any tests? Have you had an endoscopy, for instance?
I've had that done once, yeah.
And did they tell you what the diagnosis was? Did they find anything at that endoscopy?
They said I had reflux, and they just said to keep taking the omeprazole.
Okay. So you've reached the stage now that you're thinking about looking at alternatives. What's caused you to do that?
Because I feel I've been taking these pills now for 8 years, and I've looked into some of the side effects, and I really would like to stop taking them if there's another option.
Where have you read about that?
I've Googled it.
Okay. Yeah. And where did you find out about Reflux UK?
Oh, my GP mentioned you actually.
Okay.
Yeah.
Okay. And so one of the options that you wanted to talk about was potentially thinking about surgery. Is that right?
Yes, although my GP did explain about fundoplication, and I have to be honest, I don't really like the sound of it.
That's very interesting, and what you've just told me is a really pretty typical story. You're describing, I would say, all pretty classical symptoms of gastroesophageal reflux disease. It's a very common condition. There's probably 20 to 30% of the population get reflux on a regular basis. If you look at this little diagram here on the website, most people think about reflux as being caused by too much acid. Mm-hmm. And actually that's not the fundamental problem. When we swallow, food goes through obviously through the mouth, then down through the esophagus or gullet into the stomach. Now the stomach secretes acid, hydrochloric acid, and lots of other substances which are really, really corrosive. And if you put gastric acid on the back of your hand, it will burn it. So the stomach has all sorts of clever mechanisms to protect itself, but the esophagus doesn't. So normally there's a valve at the bottom of the esophagus which stops food and acid and other things from the stomach regurgitating or refluxing up into the esophagus. So when we swallow, the food will go down, the valve will open, the food will pop into the stomach, and then the valve will close behind the food to stop the reflux. Now, in GORD, or gastroesophageal reflux disease, the valve fails, and that's the primary problem. So, when you've got gravity on your side, you're standing up during the day, most people tend to experience less problems than when they bend over or at night time, just as you've described. So, the options really fall into three categories. The vast majority of people will change their lifestyle, and in the way that you have. They'll change what they eat, they'll change when they eat, reduce alcohol or modify the things that they eat in order to try and prevent their symptoms. But that doesn't work for many people, and it's the next step usually is to take these high-dose antacid drugs. The PPIs, proton pump inhibitors, and omeprazole is one of those. Across the world, millions of people take these drugs, and they're very effective antacids. But the problem is not only do they have some potential side effects, but also actually probably 20 to 30% of people who take them to cure their reflux still get their symptoms. And the reason for that is it's not actually addressing the fundamental problem. The valve, it's not fixing the valve, so that's why you continue to get the regurgitation symptoms. Yeah. And why your voice is probably being affected, because you're still getting stuff from the stomach coming up and affecting the voice box. It might not be so acidic, but it's still getting there. Yeah. So it's in that group of patients, and I guess you're probably one of them, who potentially could benefit from surgery. Now, you've read about surgery, have you? What have you read?
My GP told me about fundoplication, but I really didn't like the sound of that.
Why was that?
I didn't like the fact that I wouldn't be able to vomit or belch.
Okay. Well, not everybody finds themselves unable to vomit or belch, but you're right. The most common operation at fundoplication, I can show you on this little diagram, it essentially is a keyhole operation, and it involves wrapping a bit of the stomach around the bottom of the esophagus to make a new high pressure zone. And you're right, it's a good operation, but it is associated with side effects, and maybe 20% of people, for instance, can't belch or vomit afterwards. So that puts quite a lot of people off, and that's why we've been trying to find alternative treatments. And the most recent technological breakthrough has been the Linx device. So the Linx device is slightly different. Well, it's very different. It's a keyhole operation, so it's minimally invasive. Majority of people can have the operation done as a day case, so they're in and out of hospital on the same day.
Oh, right.
And what it involves is placing a little bracelet of magnetic beads around the bottom of the esophagus. So it sits around the bottom of the esophagus, you can see on this diagram. And when you swallow, the food will go down the esophagus, and the pressure in the esophagus will open the magnets and allow the food to pop into the stomach, and then the magnets will close behind and close the esophagus behind the food. Actually, probably about 5,000 people worldwide have had this operation since it was first done 8 years ago. We've now got a lot of evidence that it seems to be safe and it seems to be very effective. I think if you were considering having surgery of any kind, the next steps would be that we need to get some more information. We need to do some tests. Right. We need to do an endoscopy to have a look down into the stomach, make sure you don't have a very big hiatus hernia, for instance, have a look at the lining of the esophagus. I think we'd also want to assess formally just how much acid or other reflux you're getting, and we'd also want to check that the esophagus was working normally, the nerves and the muscles are working normally. So we'd need to do some tests. That would involve placing a little tiny tube down into the esophagus and measuring those things over 24 hours. So I guess the question for you that you have to answer is just how much is this affecting your quality of life? Interestingly, I see from the questionnaire that you filled out beforehand, we ask all our patients to fill out, that you do score quite highly in terms of how it's affecting your quality of life. So, you know, all operations carry risks.
Yeah.
Even though it's a keyhole operation, we're still operating inside the abdomen, so there are risks. And I guess you've probably read about those on the Reflux UK website.
Yes, yeah, no, I have, yeah.
So I think you have to balance how much of a problem your reflux symptoms are compromising your quality of life, and therefore how much and potentially you'll be willing to take the, albeit small, risks of having an operation.
Yep. No, I am very interested in this, and I think I would like to go ahead with the tests at least.
Okay, well that's perfect. What I will do is I'll arrange for you to come in for the endoscopy, which I'll perform myself. I'll also arrange for you to have the esophageal test. You might want to read a little bit more about Linx with that pamphlet, and when you've had the test, we'll meet again, and then should be in a position to decide what you would like to do.
Okay, thanks.
Very nice to meet you.
Thank you.